we'll go ahead and start with introductions, and then if Deborah comes on or Sandra comes on, then we will introduce them toward the end.
Sure. My name is Julia Morocco. I am a medical scribe in pediatrics mostly at Mountain View and Palo Alto Mayview locations. And so I work with Dr. Polly. She's our pediatrician at Mayview. And I've been working at Mayview since February 2022. So it's been a year.
Excellent. Thank you. And then Reshma, if you would like to go ahead and introduce yourself.
Sure. So my name is Reshma Thadani, and I'm a pediatrician. My official title is Clinical Assistant Professor of Pediatrics, and I'm actually employed by the School of Medicine at Stanford. And I do my clinical time at Ravenswood and also in the Stanford newborn nursery.
Oh, okay, wonderful. And I'm Sasha Madison. I'm the co-chair of the BooksPlus committee, and I have a particular interest in this topic because I worked in healthcare prior to retiring. So I was the administrative director for infection prevention and patient safety for Stanford Healthcare. So the adult side, not the children's side, and very interested in literacy and early childhood development, and so that's part of my my interest in this particular project. So I'm going to go ahead. I'm going to be looking down here at the questions. If you hold on just a moment, I will go ahead and begin. The first is really what inspired you to collaborate with Rotary and bring me a book on the early childhood literacy project.
So I can tell you that our patients in general, they do not have access to books in the home. If you compare children from low-income families to higher income families, then there's a huge difference in the number of books at home. And we know that the more books you have at home, the more likely you are to read and engage with books. And it just helps in terms of early literacy skills. And so the more that we can help our families have books in the home is one of the main reasons why we partnered with you all. We just need multiple different avenues to be able to get our families to have books in the home. So we really appreciate the collaboration and the support.
Great. And then what medical or educational literature do you draw from really to support this early childhood literacy, reading, toddler, development as part of the early childhood development? Is this something that's discussed in your education, or is it something that you then read about or learned about later on?
So in my medical training, we learn about the stages of development and what babies can do and how they're learning. But we never truly learned how much they are taking in and how much from birth they are actually learning and processing. In the last 10 to 15 years, there's been a lot more work that's been done in brain science, especially for children 0 to 5, and actually what's going on. We actually have learned a lot more than we ever knew before about neuronal connections and brain plasticity, and that these children are not just these, blank beings that will only learn later on, but they're actually learning from the day they're born, and that requires stimulation from the day they're born. There's many different studies that we sort of refer to when we're working in, communities where there's disparities. One such study was done by Anne Fernald at Stanford, and she pointed to something called the 30 million word gap, and that speaks to the fact that there's a word gap of 30 million between children who are preschool age from higher income families versus lower income families. And so when you already start kindergarten behind in terms of your language skills, it impacts your learning, and it just sets off for a trajectory that where the disparities can persist. We also know from a lot of research in the last 10 to 15 years as well, looking at like high school graduation and what predicts that. What they've found is that what predicts high school graduation is your third grade reading scores. And what predicts that is, did you enter kindergarten ready to learn? And the country as a whole has been moving more towards more academic kindergarten than decades ago. And we're seeing that our patients just are not ready. So what we have found is really focusing on the 0 to 5 group in the pediatric medical home is the best way to reach these families who are not quite yet connected with the school system, because many of the children do not have the opportunity to attend preschool. And so that's why we see it as it is important for us to do this work and promote literacy, because they're not hearing it from other sources.
Well, that's very interesting. I didn't realize the 30 million number that you mentioned. So
Yeah.
that's very, very interesting work. So I guess you described your population a little bit, but can you tell me a little bit more about the population that you see both at Ravenswood and the Mayview clinics, as far as socioeconomic status, perhaps, again, immigrant status, and how bilingual education may come into this? So any other tidbits of information you can give us about the population that you serve at both of the clinics?
Sure. So we are a federally qualified health center. Ravenswood merged with Mayview about 2.5 years ago. So the entire organization is a federally qualified health center, which means we serve low-income families. About 75% of our patients identify as Latino, about 3% African American, 4% Pacific Islander. Our Mayview sites, I think, tend to have a little bit families from other backgrounds as well, but essentially 88% of patients overall identify as being from an ethnic minority. 90% are low income, and of that, about 63% are on Medi-Cal, and we have a good chunk of also uninsured patients, but that's a combination of adults and children. Children are more likely to be able to have Medi-Cal. And across the organization, we serve about 7,500 children, and that's everyone under age 18.
Oh, okay. So that's a large number. So again, and you mentioned how many, the percentages that are in what we would consider like under-resourced
Correct. Yeah.
households. So that's a large percentage. And I think for us, particularly in the Bay Area, that there's such a huge difference in economic status. And the assumption, I think, oftentimes is made that everyone has access to books, or why don't they go to the library or whatever. And so I think it's very helpful to know, again, the importance of bringing books to the family. They're not likely to ask. And so I think it's really I feel like it's a very, very positive, way to ensure that our patients get books, and that it's done with dignity and respect.
Mm-hmm.
Which I think is also, are most of your patients then, do they reside in East Palo Alto, East Menlo, Mountain View area, or is it a broader area that you serve?
So it's definitely East Palo Alto, East Menlo Park, Redwood City,
Yeah.
Mountain View, Palo Alto, Sunnyvale, San Jose.
Okay.
And then we even have some families from North San Mateo County. So, we do have a few families like from South San Francisco, Daly City, San Bruno. So our patients are pretty spread out.
Oh, interesting. So I didn't realize that your area was as large, your catchment area as you described. So
We can
so you're
see
definitely,
anyone from San Mateo County and Santa Clara County just with the health plans that we're contracted with.
oh, okay.
It's quite a distance for families to travel. But you know, I think we give high quality care, and so
Yeah, yeah.
they come to us. And so we do have patients that travel a bit of distance to come see us.
Oh, excellent. So I'll ask both you and Julie. I know we've asked these questions before, but can you just mention to us, you can give us maybe 2 or 3 or 4 stories that you just feel getting the book really made a difference in the patient visit, or perhaps the families came back to you and spoke about the books, or any stories you can give us, because that really brings to life the project that we are doing with you.
Yeah, absolutely.
So I don't know, Julia, if you want to start.
Yeah, I have a couple. Just yesterday we had a little boy. I think he was a year old. And he was, really nervous for his exam, and he didn't want the doctor to touch him or check his ears. And then we gave him a book, and his mom was like, "Oh my gosh, thank you!" Like, he loves books, and so the whole visit he was just flipping through the book and just saying words or animals that were in the book, and it definitely helps the doctor with her exam, but it also, he got 2 new books that he was able to take home. So that was really great. And then I do remember another time we had twins. It was a boy and a girl, and they were also super nervous about their exam. And so the doctor had them both, sit together and sit on the exam table together and kind of do everything together. And then we gave them their books, and it was so cute. They were reading to each other and pointing at things in the other's book and switching books. And so they were really engaged, and it was very wholesome. It was really cute.
Those are good stories. Yeah, I like hearing that again, how it also helps with the exam, which I'm sure you appreciate very much as the pediatrician. So if you can give us any other examples.
I have one. Julia, do you have any more examples?
I think I do remember we had he was older. He was 6 or 7, and he saw the books on the shelf, because we try to keep books in the room. Just, when they're waiting, for the doctor or something, they can look at a book. And he looks at me and he's like, can I have one of those? And I was like, yes, of course, which one do you want? I'll, bring it to you. And he said, okay. And then he's like, do I have to bring it back? Can I read it and then I have to, give it back to you guys? And I said, no, this is for you. You can take it home. And he was really excited, and that was really cute to see.
That's great. Well, when they see the books, right, and ask, that's a really positive thing as well. They expect, they're interested, and that's part of what you're trying to develop, is an interest in reading.
Yeah, and also
So,
a big thing is there's a lot of siblings. If their sibling has a an appointment, they're there with mom, and then they also have a phone. A lot of kids are on their phone, watching videos or something when their sibling is getting their exam. So we had a boy this week on his phone, and then I was able to show him a book, and he was able to put down the phone and just look at the book. And I thought that was really impactful, because there are a lot of kids who are just watching videos while they're waiting. So it's nice to kind of make that switch for them.
yeah, and to make them realize that there's another way to occupy their time than just watching videos.
Hi, everyone. I want to introduce myself. I jumped in really late. I had a lot of technology problems, just slow internet and everything. But my name is Laura Arceo Madriz, and I'm a program assistant at Ravenswood. I'm in contact with Sasha all the time, and I work closely with Dr. Tadani and Julia. And I work at the main 1885 site. And I'm just gonna join in as much as I can reach. Yeah.
Well, we would certainly love to hear any stories where we are right now are any stories that you might be able to share with us with regard to the children that you serve, or even, the parents saying, or an older sibling, on how getting the books impacted their visit, or maybe any development changes that you may see later. So that's another anyway, Laura, anything that you can add to Julia was giving us some stories.
Well, I guess the favorite way that we use the books is in Centering Parenting because, well, for those that aren't familiar with Centering Parenting, it's a program that we do that provides parents with like activities that have to do with like development of their child and just how to raise and grow a healthy baby. But because they are well child checks that are attached to those visits, then they also get their well child check book. And one of the ways that we have used it is, for example, when teaching parents that there's more than one way to communicate, and like baby sign language even exists. We've used books to, go along with what we're teaching them in terms of like eat. We use the very hungry caterpillar, I think it's called, to like the caterpillar's eating, so we're teaching the babies and teaching the parents how to communicate with their child using not just their voice, but other things like toys and books and just ways to contact it. That's my favorite way we use them. But overall, because I'm not the one physically giving the books to the parents, I'm trying to get more and more stories to come up. We have talked in a group, and we've noticed that sometimes they're really excited about the books. Sometimes the books are just not something that they haven't been very exposed to, and it's just not something that the parents are used to doing with their kids. Oh, let's check out this book together. So I think that's one of the reasons that it's really important that we just keep doing this. But yeah, overall, it's going great, and I feel like we're just getting established. We're getting the ball rolling, and once we have a whole flow chart like of how things are gonna go, it's gonna make an even better impact. So that's a few words from me.
Great, thank you.
Yeah, so I can share from my experiences. So I'm only at the East Palo Alto site. And so we try to put books in our waiting room so that families are using books rather than the phones. And then we also have the books in our exam rooms. Again, just to encourage while you're waiting, check out a book rather than looking at your phone. I have one patient who her family came here from Colombia, and the patient is almost 2 now. And for the last, I think, almost a year, I've been concerned about her speech. And I talk to families from birth about reading, and it's hard, I think, for that concept to sink in for a lot of our families. They're just not used to hearing that piece of advice. And so the mom also finally, I think in the last 6-7 months, also started to share my same concerns about the speech. And prior, the mom would say, no, I'm not reading to her. I'm not reading. And every visit I would say, why? Why aren't you reading? Here's a book. Why aren't you reading? And so finally, about 6 months ago, the mom said, I'm now reading. I'm reading every day. And in my last visit with this family, which was just a couple of weeks ago, I walked in and the mom and the child were looking at a book together, one of the books that we have in our exam room. And that just blew me away because I had never seen that type of interaction with them before. And so I commented and I said, "This is amazing." And she said, "Yeah, the girl now loves books. I'm reading more. I'm taking books that you all have in clinic. I'm taking them home, whatever you give me." I show her books. And I could even see in that visit that the girl was pointing more to the books on the windowsill. And I'd never seen that behavior before. And so it was just a wonderful moment where we really truly can make a difference, just, little by little with exposure to books. You mentioned the libraries, and a lot of our families just don't go to the library. They're not used to it. They're, unaware that things are free. So it's been hard to just say, go to the library, get a library card. So the more that we can do in clinic to give them the resources, it's super helpful. And you can see behind Laura are all the books which you all provide and other donations. And so that's what we use in our exam rooms and in our waiting room.
Yeah, that's great. I was thinking as the population, again, oftentimes people are working perhaps 2 jobs, working weekends, et cetera, and to take time out to go to a library, get books, come home is difficult. And so the more we can do to ensure that the books are there and available, that was, I think, one of the things that certainly when we talked about this project kind of spurred us on into it. Just removes one barrier. And if you can sometimes just remove one barrier, you're able to provide an environment that's very, nourishing in that we're able to just, here's the book, go ahead and start, as opposed to having this other barrier that is difficult. Plus, I was thinking, if there is, if you do ask, are you reading to your child, and the family doesn't have any books, I would think that prior to this program, for instance, it would be difficult for a family to say we don't have any books in our home, so I think that this again provides resources which I think are really important. I guess the last question, because we're almost done, only 2 minutes left, is there anything else we can do to strengthen the program? Anything that you think would be helpful? I guess part of our question, Joe is going to be taking this and editing it a little bit, or would you feel comfortable in us sharing this, what we've just, recorded? So any other thoughts that you have, particularly on what else you may need? Not that we know whether we can provide it, but anyway, now's your time to let us know your thoughts on the program.
I mean, I think the program is wonderful, and we truly appreciate all that you all do. We are in constant need of books, like especially the board books for our younger children, for like the 0 to 3 population. Those go very, very fast. And like I mentioned, we're participating with you all, but we also do Reach Out and Read. We do Talk, Read, Sing. There's a program with Stanford where students get us used books. So we are getting books from all over, and it's never enough. And so I will say our need is definitely more board books for 0 to 3, but also more culturally diverse books, books in Spanish, because sometimes our waiting room, all the books are in English and geared towards older children. So that is definitely a need. Excellent.
Okay, we in the book list that I created based upon the early work that I did with Julia, we have kind of the titles that everyone liked the most, kind of that went the quickest, and we have some English, but I think the bilingual is the largest category, and then some Spanish as well, and then English. And so we will continue to provide those, the main titles. I think we have about 12 or 13 titles that are the main ones that we're providing, and they are the board books. So it's good to know that we're on the right track. And certainly keep both Laura and Julia aware of any changes or any other ideas that you have on books that that you need more of, but it's good to know the board books are what we definitely have designated for the 2 sites. So I think with that, we ended right on time. I just wanted to let you know also that the person that I worked with that kind of founded the Bring Me a Book, and it, certainly worked on the BooksPlus program, and did quite a bit with Stanford as well. Judy Koch has passed away, but we will certainly carry on her work, her legacy. And this is probably one of the parts of her legacy that we are all very excited to continue and to expand, hopefully to other Rotary clubs. I know that was her other vision. So anyway, thank you very much. It's really a pleasure to get to partner with you and to know that we're helping this next generation, which I think is really important. And as the daughter of immigrants, I also think it's very important to ensure that the first generation children are exposed to literacy early. And so I was very fortunate and to be exposed early on. And I think that certainly helped me with language development, as English was not my first language. So anyway, it's wonderful to work with all of you. Thank you. And, make sure you reach out if you need anything. I know both Laura and Julia have my email, and happy to work with you.
Thank you so much.
Thank you so
Thank
much.
you.
Appreciate it.
We really appreciate you.